Hello everyone, I'm Dr. Shireen Saini and welcome back to our initiative, What After Dentistry. Now today we have with us Dr. Patel, who is a practicing dentist in Canada. Dr. Patel graduated from the Coorg Institute of Dental Sciences in 2007 and received his NDEB equivalency program in Canada in 2015. And then in 2016, he received his dental license in Canada. He specializes in dental implants, wisdom tooth extraction, and endodontic root therapy. Dr. Patel strongly believes in patient comfort and takes pride in his warm and professional chairside mannerism. We welcome you, Dr. Patel, and thank you so much for coming on board. And we hope to have this session today on scope of practicing dentistry in Canada. And I'm sure this is really going to motivate people out there. And we hope to get a lot of information from you. Thank you so much once again for coming on our platform.
Thank you, Shireen, for having me on that. And I will try my best to give as much as information I can give.
Thank you so much. So before we formally start into the discussion on how to practice dentistry in Canada and the US, we would like to know more about your journey. How has been your journey after completing BDS? Any struggles or achievements that you have gained so far in your journey?
Shireen, I landed in Canada in 2012. And I got my license in 2015. So yes, there was some hiccups to register myself for NDEB because there are some documentation which really requires directly from your college. So I didn't knew about that. So what happened was first time when I applied, I got my document sent to my home place in Gujarat, and then they send it to the NDB, which they directly reject because they like it directly going from the university to the office. So this is very important for anybody because of that I lost my 1 year because they just canceled my whole application. So I have to redo that. So this is very important. So those who wants to register for NDB, I will recommend make sure that your university, the document which is asked by NDB, get it from your university directly. So directly mailed to the office in NDB so that it is considered valid. If you have another postal address, they will reject your application. That was the biggest hurdle I ever faced. The second problem was, yes, the exams are really precise. We don't have that much experience in our schools. To be frank with you, we don't do that much practice, like crown cuttings and all those stuff. They have really good dimensions which we need to meet. If you miss by 0.1 millimeter, that's where you will face the trouble. So I had to work hard. So I failed one time in that clinical skill, but second time I prepared myself really nice and I was able to do it. So yes, everybody can do it. Just do not lose hope. Give your best shot. That's what I will say. Once I got my exams done, I think pretty much I got with a good group, Sandhu Dental Group in Ottawa. They are one of the leading in the Eastern Ontario. So which is one of the fantastic group which I'm working with. So it was since 2016, once I joined, then my graph had gone up. So I don't have to look back now. And really the life has changed from where I start and where I am now. It's totally different.
Absolutely, I can totally comprehend, because dentistry, what is practiced here in India and what is practiced abroad, anywhere in India, outside India, I think it's totally different. And I'm sure how it is done in Canada or even in the United States.
So Sharon, for that, I will say in this way, Canada has a really good opportunity for many dentists because frankly speaking, to go to the school. So once you go to the school, you are looking around $200,000 to $300,000 expense in the schools, right? Now to get into the school, it is another 50 grand. So you are looking at really huge amount. Whereas when Canada is allowing you to do show your skills. If you can pass in 3 years or 5 years, fine. You can directly become a dentist just by spending 50 grand. You understand? So there is a huge difference with that. So that's why I prefer Canada in that way, because you don't have to go to school. Frankly, like just compare in that way, how many people are going for the school and how many schools are there.
Exactly.
It's a really, yes, the exams is really competitive, but I will say once you learn how to do it, basically you have to do a time management, which is very poor in our Indian students. Like they don't have time management. They take their like they think, oh, everything can be done. No, that's why I failed my first exam, was because I was running really late, and when I tried to rush, that's where I made a mistake, and I just missed by one grade. So that taught me everything. That cost me another 30 grand, but that taught me everything. So second time when I went for the exam, I was so well prepared. Like, okay, I was working like a machine. Like, okay, after this step, I have to do this. I practiced like that, like for whole time during the preparation. I practiced in like that. Okay, after this bar, I'm going to use this bar. I'm going to use this instrument. So you make yourself. And I was able to finish the exam within 4.5 hours rather than 7 hours.
That's
So
great.
which is like really, so you have to learn, just keep on doing, like it's a repetitive exam. Like it's the most easiest exam I ever seen, where you know the paper that okay, they are going to come from this only, but their specifications are so much. If we are not able to manage the time, that's where we make mistake.
Okay. I think that's amazing information that you have shared. Time management is something that you should start learning from now itself if you're planning to go and settle in Canada as a dentist. So thank you so much.
Definitely. And that will save you like $200,000. Definitely. Just start doing that.
Exactly. So now moving ahead, could you elaborate the application process of how, if one wants to go settle in the United States and Canada, are the process same or is it a little different?
So both the processes are different. So US has a called NBED. I think it's like there is just a difference of National Board of Dental Education, and there is a National Dental Board of Education in Canada. So there are a difference on that. So practically, like I also get confused sometimes. But just put it in this way. So for USA, there are like a part 1 and part 2. Now they have started with something called dental entrance test, which is DART. So some school, when I was there in 2010, that was like some school required for DART exam. But now most of the all schools require it. So there are some schools which has 100 seats for a foreign trained dentist. I recommend those like who wants to go for USA, go for those schools where you have more seats rather than working for those university who has like 20 seats or 30 seats, because there is a ratio of for one seat. I will say you guys, like competition of one seat is equivalent to 100 seats. So 100 students, 100 applicants are there for one seat. So just think in that way. So chances of doing that will be really troublesome. USA, there is the only way. There is no direct licensing, nothing. You have to go through school. Okay. Whereas Canada, there are two options. Recently, the NDB has just recently changed their criteria. Now they are giving 5 years. You can give how many exams you want to give. Within 5 years, from start to finish, you need to finish up your course. Whereas when I was there in 2012, they gave like each exam you can just give 3 times. So if you are not able to pass in 3 times, that's it. Your doors are closed. Then you have to go through school. Okay. Right? So for direct licensing. So there are like two ways. Either you prefer to go for direct licensing or you prefer to go from school. I don't recommend school much because frankly, they are not teaching more like a more advanced thing. Like, what they are teaching is basically like, yes, they will teach you how to do crown cutting and everything, but they are not teaching you for implant or those stuff, which you need to learn from. You have to do extra course and everything there. So I don't think in that way. Just to make sure that if you can do direct licensing, I would prefer you to go ahead with that. So, and when you go for the school, you have like a University of Toronto, University of London, Western University. There in Canada, there are only 14 or 15 universities which are offering the programs for that. So very less scope to get into the school. Okay. And if you have done masters, they will give you more preferability to like get into the school. Masters has more chance than just a regular dentist. Undergrads will not has to face really a lot of competition.
Okay.
Right, but direct licensing anybody can do, and now it's a time like 5 years, which is sufficient time for anybody to just practice. I will recommend start practicing on it. Everybody can do it.
Okay. So when you say direct licensing, so if a MDS wants to settle in Canada, they have to go through the direct, when they go through the direct licensing, is it the same exam procedure, or there are different examination procedure for MDS?
So MDS or BDS, they have to like first they have to get a direct license. When you do the direct licensing, that means you are getting a license to practice in Canada. Right now, MDS, if you want to pursue, because they don't consider your degree equivalent to Canadian board. Okay, so what you have to do is like then you can practice the general dentistry. There are many dentists here, those who have done MDS in India and they clear the exam here. But then you can do your MDS if you are orthodontist, so you can practice orthodontics here. There is no restriction that to do orthodontics you need to be orthodontist.
Mm-hmm. Oh.
GP can do the practice.
Oh.
As a GP, I am doing implant and everything, right? So if you can see from my perspective, yes, if you are confident, you did the courses and everything, just do the courses here from outside, and you can still do the you can pursue your MDS here too. To get into MDS is a little difficult. As I say, there are less colleges, less seat, so it is really difficult. So if MDS wants to just say that, okay, they want to practice MDS, then I recommend them to go to school, make yourself really known to the teacher and everything, so that they can recommend you to get into MDS, because they have to accept you as their mentor.
Yeah.
So that is a big trouble, because there are very few seats. So it's very hard to get into.
Okay. So for the licensing part, if one has to sit for the licensing part, and I think there are 3 examination
Yes.
one has to go for. So for each examination, are there coaching centers, or are there courses that one should can go for? Because obviously their way of taking an exam would be totally different from what is taught being here in India. So how does one go for
So
these?
yes, once you land into Canada, or there are some coaching centers in India too. I have heard there are basically 3 exams. AFK means that's for question errors and everything. Then clinical skills and clinical judgment. Now AFK is the exam which is mandatory. If you want to go for school also, still you have to give AFK. That depends. So if you get a score of more than 95 or 90 or 95, and your TOEFL IELTS course is more than 7, chances of getting into school is more. But yes, still you have to give their the colleges does take their entrance test. Mm-hmm. So you have to prepare for that. Second is clinical judgment. So that basically they try to assess how is your clinical skills, or whether you will do the patient sometimes they want to see that how aggressive you are basically. So I rather say not to be too aggressive, treat the patient how you want it to be treated. So suppose you have a cavity, you have a filling on your tooth, right? And you see the marginal, some fracture is there, but still the tooth is fine and nothing is growing there. Would you do cavity? Would you redo the filling?
Of course,
yes. So if I will rather keep a watch on that, because if there is nothing, little fracture, margin is little fracture, but nothing is growing, it's clean, the patient is keeping it healthy, why you want to treat him and create him sensitivity or anything? So that's what they want to see. They don't want aggressive treatment. Let me be truthful to you, because you are giving pain to the patient, basically. Yeah, right? Then clinical skills are there. Yes, for all of those, you have coaching centers here. There are different coaching centers. There are, for each, you have to pay fees and everything. But the advantage with it, some coaching centers will allow you to, as I say, for clinical skills is the main, which you will have the trouble, and where the time management is the problem. So some coaching centers gives around 4 hours, some coaching centers gives 5 hours. But when I was there, like first time when I give exam, so I had a coaching center that there was no time limit, that you can spend how much you want to work. So I keep on working, but I never focus on my time management. So I rather tell any of my fellow students or any of my fellow colleagues, like, you know what, get those classes which are giving 4 or 5 hours, so that like you have to make sure that you finish day one paper or day two paper in that 5 hours. Get it checked with your instructor and make sure that you are doing a quality work in that much time. That will be your time management. That will be your everything. You don't require more than that.
Oh, that's good. That's amazing. So how much, what would be the approximate amount if one goes through the application process plus the coaching fees, when they are paying for each of the examination? So how much would you say would be an approximate average amount that a person needs to spend if they want to practice practice dentistry in Canada?
Since 2012, like when I gave the exams and everything, it cost me around 55,000 to 60 grand for everything, including my processing fee, including my loops. You have to work with the 2.5 loops, magnification loops and everything, plus your coaching fees. Everything was like for examination fees and everything. Since then, like I was talking to one of my friend and he's giving exam. So he was telling me AFK exam, when I gave exam, the fees was around like $2,500 or something was there. Now it is like double.
Yeah.
It's literally become double. Clinical skill, $10,000, which was $5,000. So they have increased the price basically. So you should be looking around, like, because, okay, in this way, just think in this way, you are looking at expense around 100,000, 70 grand, 70 to 80 grand. Because clinical skills, the main expense is the clinical skills, the tooth which you will be preparing, because they have a specific type of tooth, typhoid tooth. They are like, one tooth can cost you around $20. So this is the most, and like once you use that tooth for your exercise, it's done. You cannot reuse them. That is the trouble. So that is the most expensive. So clinical skill is the most expensive. So it depends on, like, some people like has a really good like hands-on or anything, they can work really nice. They will require less, but you should be looking from around 70 to 80 grand.
Okay. So when you say
Plus your living expense and everything will be different.
I was about to ask you that. Yeah.
No, that is the different.
So approximately one should have like look around 90,000 to 100,000 rands. Will that be correct?
I will say it in that way, but frankly speaking, like 20,000. If you are putting as 20,000 for your rent and food and everything, it's less. Okay. Your yearly expense, because to rent, okay, if unless you are staying with somebody else or sharing the rooms or anything, that you can do it. But if you suppose like a majority of the students might have like now comes with the family, right? So I say it in that way. And the rent, if you rent any house right now, the renting is going to be really costly. That is the main problem. Even the basement, many people gets basement here for the rent, and they are paying around $1,500 just a rent.
That's huge amount.
Just a rent, because that includes your, they give you Wi-Fi and everything, food and like water and those all are there. But again, the food and everything is separate. So you are looking around monthly average of family of 3, monthly average with the rent and everything, $2,500 you are looking at.
Okay.
Right. So that is a big trouble. Mm-hmm. I totally understand. There are many students who has done this way also, and I don't recommend them, but yeah, you can do that just to save the cost. So they used to come here as a visitor visa or anything, and they used to give the exams. But I will recommend you, like, if the border security or if the government find out that yes, you are not here for a visiting purpose to give the exams and everything, you are like risking very big. That is a big trouble.
Exactly.
Right. So that many people have done, but like, I just don't want anybody to think in that way. Yes, I'm not saying you to do that way, because you are putting yourself, because once you are in the list and they put you as a black mark on your visa, that's it. You will not be able to enter again. Right? So be truthful. I understand it's expensive, but you can do work as a part-time job. So what I used to do was like at night shift, I used to work on the front desk at the motel and everything. So I can study there and I can take out the expense. So yes, you have to work hard. But first 3 or 4 years is the struggle. Then you will be having a hefty good life.
Right, exactly. So now, when you say like 70 to 80,000 grants, what do you mean exactly by grants? Because audience will not
$1,000, $70,000 to $80,000 Canadian dollars.
Canadian dollar. So now, when you say 70 to 80,000 Canadian dollars, is there any support from the government? Can you take a loan from the Canadian government, or the entire amount needs to be taken care from the person's own pocket? How is it?
Let's start with this. So if you come as a student, there is no grant for you because you have to pay, like you already getting you have to pay to the college and everything. You just can get as a 20 hours work, like legally you can work outside to earn some money. But unless you come as an immigrant, like you are immigrating to Canada and you have legal rights to work, legal rights to do, then only. But initially the bank also will not give you new immigrants and all the money and everything. So you have to first show, like when I came on, like I married to a Canadian girl, like my wife is Canadian immigrant and I married to her, I became on her basis, spousal basis. So when I came here, I work into the, like, as I say, I work in a factory. So factory also, I have worked as a front desk in the motel. So I created my credit. Once you created your credit, then only banks see that, okay, you are eligible, like, will you be able to pay their money back? Then only they will give you some funds. Otherwise, there are very slim chances that they will give you.
Okay.
My relatives helped me for my studies. My parents were in US and my dad supported me for my education. So that was the thing which really helped me.
Okay.
My wife was then, like, she was working full time. So she was taking care of my home expense and everything. So basically when you come here or anybody come with the family, make sure that rotation of money means cycle. One person has to do business, the other can focus on studies, get it done, and then second one can study. If both are dentists, that is the best way.
Yeah, I think that's fine. So that should be the best way only to survive in a country.
Yes, like to take like $70,000, $80,000, it's really hard hit. That's where many people are getting into stuff. So many people, what they do is like they come as an immigrant and then they work here. So as I say, part-time. So AFK, you don't require 100% full attention or anything, right? So AFK, you can do like a part-time. As I said, clinical skills, the first time when I saw, when I took the exam, so what I was doing is like I just left my job and everything and I was focused on that. So but time management was not there. But second time when I did, the first thing was in my mind was the time management. So I took a class which was giving me like just 5 hours. Now if 5 hours rest, I can work in a job, I can do the job at some place. So that way you can keep on rotating,
I think that's fair enough, and that should solve the purpose of getting.
Yes, you have to do like for 3 years, little bit hardship, but after that, sky's your limit. That's what I will say.
So now, I mean, when you have already spent so much of time and you spend so much of money also in practicing dentistry, in getting the examination. So at the end, do you think is it really worth all the hard work that you have done so far? And for anybody who's trying to come to Canada as a dentist?
Yes, 100%, 110%, or like the maximum you can say on that. The reason for why I said that was the initial, like, so first year when a dentist can, like, yearly income, the first year is 80,000 for any new graduate per year, $80,000. Yes, you have to pay a lot of tax and everything, but the dentists are considered to be like a cream of the like, the country, because they make a lot of money and everything, right? There is a really good scope of that. Like, it's just what I say is like a little bit hardship. Once you get back to the dentist, then your monthly income will be go up to $20,000. So average income, like from next 2 years or 3 years, your average monthly income will be 20,000 per month, which is more than sufficient. Like, just think in that way. I was in India, I was earning 20,000 rupees a month.
True.
And now my income is $20,000 a month. There is a huge difference there.
Exactly.
Right? The quality of life is a huge difference here. Like in Canada, yes, everything works in the rules and everything, but the standard of life is really high here. The people don't have to, schools are paid by government, so you don't have to worry about that. Yes, you like, it's your choice. If you want to put them in private schools, you can do that, but schools are covered. Health is covered by government. You don't have to worry about anything. You can purchase house and everything. You have a peaceful life then. With that, every time, like, there is a saying, like, the more you progress, the more expense comes, right? So, but your standard of life goes up. That's what I will say. And I will say 100%. Yes, due to COVID, at this point, I don't recommend anybody to try to immigrate to Canada. I will not recommend anybody, because NDB is really in a backlog, really big backlog right now. They don't have, rather they are not taking any, they do take, but they are like not giving anybody for registering for exam. So definitely there are so many applications which has been approved, but they cannot take all those, they have limited numbers of candidates they can take for the exam. So like suppose like 500 or 600 students, they can take an exam at one time, but they have almost application right now is around like 15,000 or something.
Yeah, it's super.
So I will not recommend right now. I will just say hold your horses right now. Let this COVID stuff finish. Let them get back to normal. And then once it is normal, yes, you can try to come here. But because to go into like AFK, to give exam for AFK, even if you want to go to school also, there is a huge waiting list. There is a very huge waiting list. And I will say, like, if you are lucky enough to get into it, fine. But then you are taking a big risk. There are many friends who came here since last year, and they haven't been able to like register themselves for first exam. And NDB has canceled already. Last year, they canceled 3 times. So it's like you come here and then you get a little bit depressed. That's what I want to give you guys heads up on that yes, this is not a good time to come to go Canada. USA has been taking exams and everything, but still the same scenario. You don't know what's going on right now, right? So when you are looking, like, you give, suppose you are earning in India and you just like shut down your clinic and come to here, and then you see, oh, I'm not able to pursue my education here. I don't want to give you guys any wrong hopes there, but this is not a good time. That's what I will say.
I think that's thank you so much for sharing this, because the real time information only a person sitting there can share it. Otherwise,
yeah. And I'm the person, like, I like to give them a truthful. I'll be truthful, and it has to be that way. If I get you guys here, like, if anybody who is listening to my interview and they say, okay, oh, he is making a lot of money. Yes, don't see that how much money I'm making. The expenses are there, and we are making, but yes, living standard has gone up. But on that, to reach that level, you have a big hurdles in the center there, which right now is so much backlog there that it will be very difficult. And that's where when the people come here, I will not lie, 2 of my friends had lost the hopes, and they are not going to pursue their education in dental field. They are going they are changing their field. They are going for different fields. So, and which was heartbreaking for me, because they asked me when they were, and COVID and everything came, and I told them, yes, the life is beautiful and you should pursue that. And when they came here, and because of COVID, everything just changed, right? And that was really heartbreaking for me. But I just tell everybody now, those who are here, I just tell them, yes, don't just hold on to NDB, move on to the other. Once everything backlog goes back, you can come back and finish up that job.
That's
right?
a piece of advice that you've shared with us. Thank you so much. So the another thing that I wanted to know, and I'm sure the audience would also want to know, is if somebody takes, so this is all about the dental licensure and the examination process.
Yeah.
Somebody takes that route of taking, after the AFK, they want to get into the DDS program. So then for that, is there what is the expense, and does the government, give you a sponsorship or maybe a loan for that?
Yes. So college, as I say, it depends on which college, which university you select. So some university does have their fee guides are totally different, but average fee guide is around 230,000 to $300,000, means 3 lakh. 2 lakh 30,000 to 3 lakhs Canadian dollars. Yes, you will get the financing from the banks. Banks does give you the student loan and everything, but only those who are immigrant to Canada. This is not for those like a student, those who are on student visa or those who are on a visitor visa. They cannot allow to go to the school because there is a strict restrictions on that. That's why I'm saying if you are an immigrant here, then only you are eligible for those services. If you are not, it will be very difficult, very, very difficult for you to get it.
Okay, I think that's fair enough. So now when we talk about, how to practice and everything, now once we get to know what is the application process and the entire process, the amount which is required, what do you think is the biggest advantage of pursuing dentistry in Canada? And what do you think is the biggest advantage one can gain if they practice as a dentist here?
See, the dentistry, what I used to work, I have worked in India too. Like compared to the dentistry, what I was working in India and the dentistry, what I'm working in Canada, there is a very big, very huge difference. And the sense of the advance. The dentistry here is quite advanced. And chances rotary instrument are first which we use in the endodontist, whereas in schools they don't teach us. In India they don't teach us, they still teach you with the hand files, which is quite outdated stuff, right? Wisdom teeth extractions, only few doctors teaches wisdom teeth extraction, whereas here it is the first thing which they teach in that schools. So there are starts from instruments to the techniques, more advanced research based and everything. Canadian dentistry follows US has the highest one, let's put it in this way. US is far ahead compared to any part of the world. They have the really good advanced or good research database, and they are very far ahead. Canada is still behind USA because Canada has very, what I will say is restricted public clearance. So suppose in USA they are uses the implant which is made of zirconia, the white implants, right? Whereas in Canada only 3 companies has been given permission. So some regulations are really different in Canada compared to USA. USA has a really far open market. You can practice anything. But yes, with it comes the responsibility too, that you have to make sure that you don't compromise with the patient's health, right? Everybody say that yes, the patient sue you and they take you to the court and everything. If you do any mistake, right, then you should be responsible for your act or actions, right? So that way you treat is don't hide with the patient. If you make mistake, tell the patient, and patient also understand here that they we are also human beings, so sometimes mistake does occur. But then what I tell to them, my patients, is I will be there. If I need to refer you to the specialist or anything, I will take the expense. Patients are happy. The problem only occurs when you tell like, oh, no, what I did was right. And okay, come on, what's going to be changed, right? Just take care of the patient and they will be happy.
Mhm.
That's the only thing. Like, don't be scared. Like many people, there are very wrong thinking in the market. Oh, you go to USA, they sue you. Majority of the suicide cases are in dentist. Yes, they do dentist, but it's a stressful field, no doubt, because you are dealing with the patient. But the stresses comes to those who likes to like hide from the patient. When you don't hide, you be truthful to them, they understand. Just be confident and be like, take a responsibility. When the dentist doesn't want to take responsibility, that's where the trouble starts,
Okay. Mhm.
right? Otherwise, really, there is a huge difference compared to India to Canada, like, or USA. The practice environment is really beautiful. People are like, I don't feel anything difference on that. You have a lot of new equipments, lot of more advanced technology. We like, which in India to come, those technology it will come, but it will take at least 5 to 6 years after. Whereas here we are far ahead of that. So that's what it is.
I think that's really, you put it very correctly, that there's huge difference. We all know that, and to gain that difference, and then to be accountable for what you do, and then learn, and then refining your skills, mastering that skill is something which is obviously going to take anyone way ahead in their career. So
Yeah.
yeah, thank you so much for mentioning that. And the other thing, and the last thing that I would like to know from you is, what is that last tip, or a piece of novel advice that you're going to share with all the people who want to come to Canada and practice dentistry?
The only thing I will say is welcome to Canada. If you can come, I will be really happy to like welcome you guys here. But just be there. Do not lose hope. Failure is the biggest teacher. Like first exam I failed, but I learned from it. And that's where I learned that the worst skill was time management. And I mastered on that. So that's what I will say. Do not like, if you fail, do not give up. Give your best shot next time. You will clear. It's like anybody, like if I can clear, there are many dentists who has cleared the direct licensing. If we can do it, just you require a little bit more hard work. Just do not give up. But once you cross those hurdles, like believe me, the life will be much easy, and at least you will be having a happy life. That's what I will say.
Yeah. So I think that's great. Is there any age limit also? That I mean,
No, that is the beauty about that. Like here in Canada and USA, you don't have any age limit. When I was in USA and I was studying there, in my class there was like 75-year-old person was there in the class. And when I asked him, and people are really open-minded here, so when I asked him, like, I'm like, don't you think he's like, no, he was changing his profession. He was electrician, he wanted to become a plumber. So he was like, no, I'm looking for changing my profession. And I'm like, wow. And he was a really big point. That's where I got motivated. I'm like, he is 75 years old and still he is not giving up. I was just like 28 and I'm like, why I should give up?
right, exactly.
There is no age limit. Any age group, even you are, if you are confident that you can clear the exam at the age of 85 also, you can come here and practice. There is no restriction there.
I think that's amazing, and that's great. So thank you so much, Dr. Hemal, for
No
sharing such
problem.
wonderful insights with us. And thank you for coming on our platform, because when you talk to an expert and a person who's already gone through, the entire process and everything, they can only guide you in the right direction of what exactly is needed at the ground level. So thank you so much for sharing. And I'm sure all the people who are listening to us today, they will be getting motivated. And thank you so much, everyone, for patiently listening to our session. And I hope that this will be helpful to you if you're looking forward to practice dentistry in Canada. And I will see you in the next video. Until then, bye and good luck. Don't forget to like, share, and subscribe to our channel, and also follow our Facebook page and LinkedIn page to get such updates as and when we, host these kind of sessions. So thank you so much once again. I'll see you in the next video. Bye. And
Bye. Take care. Thank you.
bye-bye. Thank you so much. Okay.
Bye.